Thank you for joining us for the February 4th media availability with registered nurse Hava Phillips, Public Health Clinic and Communicable Disease Supervisor and member of the Vaccine Task Force. From the North Coast News, can you explain why being vaccinated is not a free pass to travel? And will you please reiterate the quarantine guidelines for travelers who come into Humboldt from out of county and out of state?
Sure. So the quarantine guidelines for travelers coming into Humboldt County are that for any high-risk travel, we ask that you self-isolate for 14 days. And high-risk travel essentially means travel in which you have not been able to avoid close contact with others. In terms of the vaccine not being a free pass to travel, that is largely related to the fact that it is potentially still possible, even when vaccinated, to be contagious if you are exposed to the disease. The vaccine prevents symptoms, but if a person is exposed, exposure essentially means that some virus has gotten into your body, and it's possible that there is a period of time before your immune system is able to get rid of that virus entirely, where some of it could spread to others. And so, in order to protect our communities and our families, the guidance remains not to travel at all if you can possibly avoid it.
From the North Coast News, are there any updates from officials on if the vaccination protects against transmission? If not, how can schools reopen safely even if teachers are vaccinated with the general public still at risk, for example, families of students and teachers?
I think the first part of that I kind of talked about in the previous question. In terms of the safety of reopening schools, I think that this really speaks to the need to continue protective measures that we already have in place, even as we are rolling out vaccine in more and more populations. Vaccine is an incredibly powerful tool, but it is one of many tools that we have available to us, and no single tool in our collection is going to be able to prevent disease 100% of the time. And it's why it's important that we continue to use everything that we have at our disposal to prevent disease, especially in communities and workplaces like schools where we don't have the ability to vaccinate every single person there.
From the Redheaded Blackbelt, are local CVS or Walgreens going to be offering vaccines to the public? And if so, how do people go about setting up an appointment? Who is currently eligible to be vaccinated within the scope of essential workers beyond caretaking staff or medical first responders?
CVS and Walgreens have separate contracts with either the federal or the state government that don't involve public health. They exist outside of the public health system. And so we are not as familiar with their vaccine scheduling practices as we are with our own. The county is currently vaccinating healthcare workers, emergency services workers, individuals over the age of 75, in-person educators, and support staff in education settings, and we will expand that out to additional groups as vaccine becomes available.
From the Redheaded Blackbelt, what percent of local first responders have been vaccinated? Have there been any instances of local first responders declining to take the vaccine when it was made available?
For any vaccine group that we have vaccinated or will vaccinate, there are certainly some people in that group who don't choose to be vaccinated for a variety of reasons. It can be medical, it can be personal, but absolutely with any group that we vaccinated, there are going to be a few people who choose not to or are not able to get the vaccine. And so, even if you're working within a community that has largely been able to be vaccinated, it's important not to assume that the people that you're working with have been vaccinated.
From the Redheaded Blackbelt, where does public health stand on the issue of vaccinating teachers prior to reopening schools that have been maintaining distance learning options?
Well, our goal is certainly to be able to vaccinate everybody. Teachers are a very important population, and we have started the process of vaccinating teachers who are working in person, and we will be expanding that out to vaccinate educators who are currently working in distance learning settings as soon as we have enough vaccine to be able to do so.
From the Redheaded Blackbelt, when will the county be adding vaccination data to the county dashboard? Will the county COVID-19 dashboard include the number of vaccinations given locally, what type of vaccine, and any additional demographics regarding who in the community has been vaccinated, similar data as with the testing statistics presented.
We do hope to get data up on our website related to vaccines as soon as possible. It is the most important thing to us is to ensure that we have accurate data, and so that is something that we are actively working on.
From the Time Standard, how many approved local vaccinators are there in the county?
There are 14 approved vaccinators in the county right now.
From the Time Standard, when does the county expect to begin receiving supplies in greater volume or at an increased frequency, if at all? What is this dependent on, and has the state, pharmaceutical companies, or the CDC given any indication of when this might happen?
Well, vaccine really, more than any supply is the limiting factor, and we receive vaccine based on state allocations. So at this point, the federal government allocates to the states allocate to the counties. That is largely population based, and we receive an allocation from the state on a weekly basis. And our limiting factor in vaccination is the vaccine itself. So as our supply of vaccine increases, we will increase the number of vaccines that we give.
From the Time Standard, how long does public health expect it will take to administer the 6,000 second doses, of vaccine? How much will this slow down first doses? Specifically, how many first doses per week can county residents expect to be administered, and for how many weeks will that last?
Second doses are a planned part of this whole thing. We have a certain, we know that in any situation where you have to give a second dose either 3 or 4 weeks out, that there is going to be a brief period where you only have first doses, and after that you are going to be expected to give both first and second doses for the duration of the vaccine campaign. So at this point, the second doses are just part of what we are doing, and we count them into the allotment that we receive from the state on a weekly basis. It's important that individuals attain full immunity, so we are very much dedicated to the idea of making sure everyone gets their second dose. We're scheduling second dose appointments on the date that people first become eligible. I'm sorry, I shouldn't say scheduling. We are inviting people to clinics for their second dose on the date that they become eligible for that, so that they have time to make an appointment that's going to work for them within the CDC recommended timeframe.
From the Time Standard, can you reiterate the process of acquiring vaccines? Is the process automated so the county receives the level of supply it initially asked for, or do counties need to resubmit order forms?
This is actually a weekly process. We have a whole schedule that we go through. We are notified by the state usually on Tuesday or Wednesday of how much vaccine we will be able to order for the week. We do our own math locally, and on Thursday we place that order, and that happens on a weekly basis. We do not have any advanced notification beyond that week of how much vaccine we'll be getting, and Humboldt County has always ordered 100% of the vaccine that we are offered by the state.
From the Time Standard, at the current rate of vaccine administration, how long would it take for the county to vaccinate all of its residents?
It would depend very much on the amount of vaccine that we have access to. As I said earlier, vaccine is our limiting factor in Humboldt County. We have the infrastructure in place to be able to give significantly more vaccine than we actually have to give. And so the speed at which we are able to vaccinate will depend on how much vaccine we have access to, and that is going to change pretty significantly over the course of the next few to several months as vaccines potentially get approved or as the vaccine production process speeds up. I can say that it will take several months at least for us to get through the entirety of the population in Humboldt County, but the speed at which that happens is dependent on how much vaccine we have.
Thank you very much.